Do you ever have your patients asked to speak to a peer? Is that something you recommend? Like the Kidney Foundation does have trained peers, but is that something that patients are requesting?
I think it's a very important thing to do. I don't think enough people ask for it. So I think we should be much more forthcoming to obviously offering it and encouraging it, because a lot of the times people are afraid of doing home-based therapy. But as soon as they speak to a peer, it's, their fears are relieved and they think, oh, well, this person can do it. So I think it's a very, very important thing. So we try to encourage it as much as possible, but it makes a big difference in terms of how they would be able to make their decision, because they can see that, somebody else in their position and maybe even with some more physical barriers are able to do it at home, right?
And are there any side effects from stress on the kidneys? Or any techniques you recommend, if there are?
I believe that there's so much data about different things that stress will do to your body. Decrease its immune system, increase your blood pressure, just decrease your ability to tolerate different changes that's happening. So decreases your resilience. So I do think that stress overall does affect our body in various different ways. And I believe that it definitely would affect your kidneys as well, but through those different mechanisms that I was mentioning, because I feel like when people have stress and they have stress, then they're often not looking after themselves all that well either. So those things will inadvertently cause kidney issues as well.
As a busy nephrologist, do you experience stress? Do you have any techniques or tips that you would share?
Very good question. So I think the three main things, yes, I have a lot of stress. And so my main thing is exercise. So I feel that people say, oh, you're trying to exercise to do this or that. No, I do it for my mental health and for decreasing the stress. And I noticed that as soon as I miss doing some regular exercise, my ability to cope with different events that's happening, being able to be there for my patients and being able to be patient, it becomes decreased. So I just make sure that I do, even if it's just 20 minutes in the morning before the day starts, I try to do a little bit of exercise, a little bit of biking in the morning. So exercise, and then also maybe taking time to do some relaxation, meditation with it, but doing stretching and those things, I think that decreases your stress, helps with your blood pressure. Actually, it does help with your blood pressure. So I do believe that doing that and having a good support system. So I have a lot of great colleagues and people that I work with that I think help me stay also mentally healthy. So I think that's really important. It's for people to have a good community that they can, share things, share their concerns, and not feel alone. So I think that's important. Those are my top three things that I do.
Well, thank you for sharing those. Those are always important to learn how you manage, because you have a lot more on your plate than we do sometimes. Well, thank you, Dr. Kiaii, for joining us today. It was such a pleasure. I think I even learned some things today.
Thank you, Teresa. I can't tell you how honored I was that you asked me to be able to do this. It gives me great pleasure to see if I can give any kind of help to our kidney community. And I am so impressed with all the work that you and the rest of your team are doing with the Kidney Foundation. So again, thank you so much. It was an absolute honor to be part of this.